One. Hello, my name is Andrew Frisha, and welcome to my presentation on the impact of artificial intelligence on population health. In this talk, I will focus on how pharmacists use AI to influence medication adherence. Pharmacists provide an essential role to improve public health outcomes and is amplified when combined with AI. I will also explain how AI integrates with social determinants of health, helping to promote health equity and access to care. I will begin with defining some of the key terms used throughout the presentation. Artificial intelligence, or AI, enables computers to perform tasks that at one point in time required human intelligence. This includes analyzing data, detecting patterns, and predicting outcomes. Public health focuses on improving the health of communities and large populations. It focuses on the entire population rather than the individual. It is important to note that ignoring the health of an individual can have strain on the rest of the population as a whole. Finally, social determinants of health are non-medical factors that can influence the health of an individual. This can include income, access, education, and housing. We can use social determinants of health to identify barriers among differing communities to promote health equity. In this slide, we'll be going over a couple learning objectives. First, we'll describe how AI supports population health initiatives throughout pharmacist-led interventions. Next, we'll explain the role of pharmacists in improving medication adherence using AI tools. Then we'll identify how AI can address social and structural health inequalities. We'll identify how AI may perpetuate social and structural health inequalities, discuss strategies pharmacists can use to mitigate bias from AI, and finally discuss the future direction of AI in public health. Here's a couple population health goals that we'll be discussing. We improve health outcomes, reduce disparity, effective management of chronic diseases, and promoting equitable access to care. AI supports these goals by helping us determine and understand which populations are vulnerable and where intervening can have the most impact. Pharmacists play a major role in public health. Pharmacists are considered the most accessible health professions due to the large number of pharmacies around the nation. Accessing a pharmacist does not require appointments, nor does it require insurance. Pharmacists can provide medical education at any time while promoting health education and reducing misinformation. Pharmacists educate patients on accurately using medications, the side effect profile of the drug, and can recommend and refer to other health professionals when it is deemed necessary. Pharmacists also play a leading role in preventative care. Pharmacists administer tens of millions of vaccines per year. This is a crucial aspect of healthcare to reduce the spread of disease. Through community outreach, pharmacists provide accessible care to underdeserved populations and are ideal partners in AI-enhanced public health initiatives. AI is transforming the role pharmacists play by integrating data from electronic health records, prescription history, and patient behavior. AI can detect at-risk patients either by patients that are pinned to be non-adherent or by patients that are at risk of potentially misusing medications. AI can also automate reminders to help pharmacists to engage with patients, assisting in locating any potential drug-drug interactions. They can also determine which patients with specific comorbidities have an increased risk of any adverse drug events. Another crucial way AI can help is by ensuring all medical advice is accurately given to ensure no misinformation is given out. One major public health challenge is medication adherence. Pharmacists dispense medications, but also have the role to play in ensuring patient adherence. If patients do not accurately take medications, it can worsen their chronic disease state, increase healthcare costs, and strain the healthcare system. Medication non-adherence is associated with higher rates of hospitalization and substantial financial burden. AI can analyze refill patterns, demographics, and social data to determine patients that are more likely to not use medications, either by choice or due to uncontrollable factors. Pharmacists can utilize this by proactively contacting high-risk patients and encourage medication use. They can provide education on the benefits of the medication and administration education. In patients that live in areas with pharmacy deserts or area with lack of public transit, Pharmacists can coordinate delivery of their medications to promote adherence and reduce non-adherence due to uncontrollable factors. From a 2023 study that was conducted, 10,477 patients were evaluated using an AI-supported pharmacist-led adherence program. AI was utilized to analyze prior data on patients, including social determinants of health, their electronic health record, and any prior prescription data. The AI algorithm was able to identify numerous at-risk of non-adherence individuals. Pharmacists conducted personalized outreach to patients and provided education support, and they tailored the need of each individual. The program implemented numerous health centers and encompassed a diverse patient population, and the significant improvements were observed. This includes the adherence overall was improved 5.9% in hypertension patients, 7.9% in patients with hyperlipidemia, and 6.4% in patients with diabetes. Also, it was observed that the patients that met the A1C goal of their type 2 diabetes grew from 75.5% to 81.7%. It also had a significant reducing costs, about 25 to 32% per member per month cost reduction. Connecting AI with public health has shown to improve medication adherence. Adherence is not only good for the individual patients, but also for the overall population health. Better adherence means fewer hospitalizations caused by preventative means. It also means better chronic disease management control and thus less potential comorbidities. It also lowers overall healthcare costs as it leads to better health outcomes and thus fewer complications from chronic diseases. This will decrease the need for more expensive medical services and provide more opportunities to provide critical care to those in need. AI can help pharmacists to identify patients who are at high risk of non-adherence due to social determinants of health, such as low income or limited access to pharmacies. By targeting these patients that require personalized support, AI helps to reduce the disparities in care and promote health equity. Pharmacists can tailor solutions to these patients, such as providing medication delivery, financial assistance, or simplified medication instructions to promote adherence. This ensures that each patient gets adequate care that is equitable and accessible. While AI has enormous potential to improve health outcomes, it can also unintentionally perpetuate systemic biases. Algorithms are not as fair as only as fair as the data they are trained on. And if that data reflects historical inequalities, then AI can replicate or even amplify them. If an algorithm uses race or socioeconomic status as a shortcut to determine patients at risk, it could unfairly target or exclude patients. For example, some predictive models have been found to flag Black patients as a lower risk with the same disease burden simply because historically less money was spent on Black patients. The algorithm wrongly would assume Black patients are healthier and thus more adherent. The overexposure of AI in healthcare can lead to these serious issues and may worsen health outcomes rather than their intended effect. Ethical oversight and pharmacist involvement is crucial to negotiate any bias in AI. Pharmacists should review what data the AI uses and ensure it represents a diverse population. The AI should also exclude any bias or incomplete data set to prevent reinforming of inequalities. AI design should also be changed to be more ethical by including social determinants of health to contextualize risk rather than race or zip codes as predictors. AI alerts should also be combined with pharmacist expertise. Pharmacists should verify whether interventions make sense clinically and ethically for each patient. Pharmacy staff should also be educated on how bias arises in AI and why transparency matters. Patients should be informed about the use of AI and what data is used in order to promote trust and shared decision-making. As a pharmacist, we are in a central position to shape how AI transforms public health. As AI continues to update, it is essential that pharmacists stay informed not only about how it works, but the ethical considerations that come with them. Pharmacists must advocate for transparency in how AI makes decisions and ensure they remain fair and evidence-based. Most importantly, we can use AI to reach vulnerable patients who might otherwise be left behind. As these technologies continue to advance, their ability to improve care will grow stronger. Looking ahead, AI will continue evolving in pharmacy. Future innovations may include patient-specific medication dosing based on AI-mapped pharmacogenomics, patient counseling completed by AI bots, and predictive models to determine if specific individuals are at risk of chronic diseases. These tools will allow pharmacists to provide more precise, proactive, and personalized care to further promote equitable and improved health outcomes among the population. In summary, AI is a transformative force in public health and especially within pharmacy practice. By identifying patients at risk and reducing non-adherence by addressing social determinants of health, pharmacists can drive improvements in health outcomes and equality. AI will not replace human care. It will only amplify it, leading to a healthier and longer living public. Here are my references cited in APA format. Thank you very much for listening to my presentation.